All right, today we're diving into one of the most just incredible organs in the entire human body. It is a true master of transformation. So let's get right into it.
Okay, so I want to kick things off with a little bit of a puzzle for you. Think about this. There's an organ in the human body that can actually stretch from the size of a lemon all the way up to the size of a watermelon, and then, amazingly, shrink all the way back down again. What is this powerhouse of change?
And if you guessed the uterus, you are absolutely right. It's an organ of almost unbelievable strength and adaptability.
So, over the next few minutes, we're going to break down exactly how its brilliant design makes all of this possible. We're going to see how its form truly follows its function, from its overall shape right down to its tiniest layers. Okay, so to really get how the uterus works, we first have to understand why it even exists. It's a serious multitasker with 3 core jobs that basically define its entire purpose. And it turns out pretty much everything it does, its shape, its monthly cycle, all of it is driven by these 3 fundamental responsibilities. So, what are they? Well, first up, pregnancy. This is its most famous role, right? Stretching to make room for a growing baby and then contracting with just immense force during childbirth. Second, fertility. It's the one and only place where a fertilized egg can implant and grow. And third, the menstrual cycle. If a pregnancy doesn't begin, the uterus is designed to shed its special lining, basically resetting the stage for the next month. Okay, so with those big jobs in mind, let's map this thing out. Where is the uterus exactly? How's it sitting in there, and what are its main components? The basic blueprint is actually pretty straightforward. It's located deep down on the pelvis, kind of nestled securely right between the bladder in the front and the rectum in the back. People often say it's shaped like an upside-down pear, and when it's not pregnant, it's remarkably small, only about 3 inches long.
Now, here's something that might surprise you. Its position. A typical uterus isn't just sitting straight up and down. It's what we call anteverted, which means it's tilted forward, and anteflexed, which means it's also bent forward on itself. The result? It ends up resting gently right on top of the bladder.
We can break the uterus itself into 3 main parts, kind of from top to bottom. Way up at the top, you've got the fundus. That's the wide dome-shaped part. The middle and main section is the corpus, or the body. This is the crucial spot where implantation happens. And then at the very bottom, you have the cervix, which is the narrow neck that connects the uterus down into the vagina.
All right, we've seen the big picture map. Now, let's zoom in. What is this thing actually made of? What are the materials and the support beams, so to speak, that allow it to pull off those incredible feats of stretching and contracting?
The wall of the uterus, well, it's not just one thing. It's actually made of 3 really distinct layers. You can almost think of it like a high-tech living fabric. On the very outside is the perimetrium, a thin, protective coating. Then you have the middle layer, the myometrium, and this is the star of the show when it comes to raw power. And on the very inside is the most dynamic layer of all, the endometrium.
Let's just focus on that middle layer for a second, the myometrium. I mean, this quote says it all. It's the engine. It's an incredibly thick, powerful wall of muscle, and during pregnancy, its fibers get bigger, which gives it the unbelievable strength needed for childbirth. It's just a perfect example of design meeting purpose. And this powerful organ isn't just floating around in there. Nope, it's held securely in place by a whole network of ligaments. The broad ligament is like a big sheet that anchors it to the pelvic walls. And the round ligament? It's kind of like a guide wire, helping keep that forward, anteverted tilt we talked about earlier. Now let's zoom in one more time, right to that innermost layer, the endometrium. This is where the real monthly magic happens, that cycle of preparation and renewal. And its structure? It's just genius. See, the endometrium isn't just one layer. It has 2 parts with 2 totally different jobs. At the bottom, you have the stratum basilis. Think of this as the permanent foundation. It never goes away. Its whole purpose is to rebuild the layer on top of it month after month. And that top layer is the stratum functionalis. I like to call this the monthly guest room. It gets all thick and plush with blood vessels, preparing this perfect, welcoming place for an embryo. If an embryo doesn't arrive, this is the layer that gets shed during menstruation. And this is why knowing all this anatomy is so important. Because when you understand how it's supposed to work, it makes it so much easier to understand what's happening when things, when they go wrong. Let's connect a few common conditions directly to the parts we've just learned about. Take fibroids, for instance. Remember that thick, muscular middle layer, the myometrium? That's where these non-cancerous tumors grow. Or endometriosis. That's a condition where tissue that's similar to the endometrium, that inner lining, starts growing outside the uterus. And uterine prolapse? That happens when that whole support system, the ligaments and pelvic floor muscles, weakens and the uterus can slip down. See? Knowing the anatomy is the key to understanding the condition.
So when you step back and really look at it, what we have here is an organ built for radical change, for constant renewal, and for just incredible power. It's a masterclass in biological engineering. And it really makes you wonder, doesn't it? If one organ can hold this much dynamic potential, what other incredible adaptations are happening inside our bodies every single day? Thanks for watching.